Thank you, everyone, for joining us. We have very few people in the audience today, but for those that are watching the stream on YouTube and on, I believe, on Facebook Live, thank you for joining us today for our weekly press conference. The way that we'll conduct the press conference is much like we did last week. We will start things off with Dr. Jeremy Adler, our County Health Officer, and we also have Mayor John Dennis, Mayor Tony Rosworski, Dr. Wickert, and Dr. Bean with us, and all will be provided an opportunity to speak to the current emergency. I would remind for members of the press that are in the audience at some point in time when we start taking questions from the press, we'll hand a microphone to you. If you just state your name and the organization that you represent, that would be much appreciated. Also, I want to thank the folks from our technology department, Max Walling, Kent Croft, Steve Klink, Citizen Steve Klink, Paula Bennett from our office, and everybody else who has worked tirelessly to put this broadcast together. We still have some situations that we need to overcome. We truly, I believe, are doing the best that we can, so be very patient, and this will be a well-oiled machine in the coming days. So with that, Dr. Adler.
Thank you, Commissioner Brown. Good afternoon. It's good to see everybody again. As Commissioner Brown mentioned, today we'll be following a very similar format to last week. I'll be covering several topics. Then we'll have an opportunity for our panelists to make any comments, and then an opportunity for questions from the press. As of today, we have 46 confirmed COVID-19 cases in Tippecanoe County. We have now had 2 deaths. Our second death in the county occurred yesterday, involving an elderly person who was receiving hospice care. As I mentioned last week, the health department has set up a system to report suspected COVID cases. That system went into effect 2 days ago, Monday afternoon. Thus far, we've had 0 reports, although we expect that as time goes on and more people start to use the system, we will have more suspected COVID-19 cases to report. In terms of testing here locally, well over 2,000 COVID-19 tests have been performed through the Indiana State Department of Health, the hospital labs, and commercial labs. So our testing availability continues to improve, and that's very important for us to get a better handle on exactly how much COVID-19 is in our community, and that will, of course, help to guide our community response. Last week I discussed the projected surge date for Indiana as being April 16th. This past Monday, 2 days ago, our State Health Commissioner, Dr. Christina Box, modified the projected surge date to late May for Marion County, late April for Marion County and early May for the rest of the state of Indiana. So that creates somewhat of a shift for us in terms of our preparations. And so we're looking at a surge here locally in early May. And that, of course, makes it all the more important that we all stay strong, that we all stay the course when it comes to our stay-at-home order that was issued by Governor Holcomb. We all need to be following that order. We need to be staying at home unless we are needing to travel for essential reasons or participate in essential activities. We also need to be social distancing when we are out. We need to keep a distance of 6 feet between ourselves and other people. We need to avoid large crowds, and we need to be practicing meticulous hand hygiene. These are the measures that are going to help us most as a community in terms of preventing a large surge so that when our surge comes in early May, hopefully we can keep the surge to a less extent by doing these measures. I did want to remind everybody about the CDC's recommendation for wearing masks. The CDC now recommends that all people wear cloth face masks when in public settings where other social distancing measures are difficult to maintain. For example, grocery stores and pharmacies. It is also important to remember that even with a mask on, we all still need to follow the social distancing guidelines. The masks do not make us invincible. They're just another tool, another step to help lessen the spread of coronavirus in our community. I did want to provide some instruction and guidance on what to do if you become sick. With our surge possibly occurring within a couple of weeks, it's important for everyone to know what to do if they do become sick. First, we need to stay home except to get medical care. It's important to separate yourself from other family members to the best of your ability, and it's important to call your healthcare provider. Your healthcare provider can provide you advice on what to do, where to go to get tested, what sort of care needs to be taken, so that you can care for yourself and also protect those around you. If you are experiencing severe symptoms, such as trouble breathing, persistent pain or pressure in the chest, new confusion or inability to arouse, or bluish lips or face, it is important to, of course, seek immediate medical attention through one of the emergency departments. I was reminded prior to the meeting by Dr. Wickert to also emphasize that it is important to not hesitate to seek emergency care for other emergency medical needs, such as chest pain, broken bones, strokes, and other things. There have been reports of people, unfortunately, delaying that sort of care because of a fear of the coronavirus being at the hospitals. It's very important to know that the emergency departments are open and they are safe, and they are willing and able to care for people with these other emergent needs. And so let's not hesitate to use those services when we need them. I did want to make a comment about the health officer's order for the postponement or cancellation of community events in Tippecanoe County through June 30th. This order is intended to apply to large planned community events such as festivals, fairs, carnivals, camps, and sporting events. Because the planning for these events typically needs to take place 1 to 2 months ahead of time and involves a significant amount of time, effort, and money, I felt that a decision needed to be made now about large community events that were scheduled through June 30th. In making this decision, I took into consideration what we know about the course of the COVID-19 pandemic from other places in the U.S. and around the world, and I asked myself, is it realistic to think that we could safely hold large community events involving hundreds or thousands of people in May or June? And the answer to that question is, unfortunately, no, it would not be safe. The risk would simply be too high. Even if we are at a point where we are reopening our community during May or June, and the process of returning to normal life would, of course, need to be a very cautious, gradual, and graded process, I believe that we would not be at a point in May or June where large-scale community events could be held safely. While I realize that this decision is disappointing to many people, it is the unfortunate reality of this pandemic. The last thing we would want to do is something too soon that could worsen our situation or bring about a resurgence of COVID-19 in our community. With that, I will open the discussion up to other panel members if they have anything that they would like to add.
Well, I've been asked if I could present some data and information regarding appropriate use and wear of masks. So as we move into this new era, most individuals are not used to wearing masks. And so I think it's worthwhile that we talk about some principles about how to wear a mask and what's most important. So I did bring some visual aids since that's the way it works best for me. So I have a sack, just like a lunch sack, plastic lunch sack with my name on it. So if you're wearing a procedure mask, like something of this nature that many individuals have around, let's talk about getting it on and getting it off appropriately. So if this is the first time you would use it, of course, you'll put it on around both ears. You'll gently make sure it's over your neck and gently press to make it firm. And then, of course, after we did that, we would wash our hands. Now, the challenge is most individuals are not used to wearing masks for any long period of time. So what they tend to do is they tend to fuss with it or manipulate it and recognize where is it potentially contaminated. Well, it's on the outside of the mask. So if I readjust my mask like this, well, I potentially contaminate my hands. So every time I touch my mask, I would need to wash my hands again or use a disinfectant. When I take it off, it's very important. When I take it off, I will gradually take it off gently around both ears. When the mask is like this, and remember, the part that's potentially contaminated is the outside. So what I want to do is grab the edges. I want to pull on the inside of the mask, which can be challenging. And I want to fold it in half, and then fold it in half again. So the potential contaminated part is inside, not outside. I would then put it in my sack, wash my hands, and then come back and fold the sack up. The reason I put it in a paper bag and not a plastic bag is that as you wear the mask, there's condensation on the inside of the mask. If you put it in a plastic bag and leave it for a long period of time, potentially there could grow things in that plastic bag because it doesn't breathe. Same element for, and I have a cloth mask, same element. So again, the outside is the part that potentially be contaminated, so that when I put it on, same element. When I take it off, I want to grab it on the inside and fold it so that, again, the outside of the mask, which is potentially contaminated, is contained, and fold it up and then put it in a bag or some kind of element. There really are some not to-dos. Can we talk about some of the not to-dos? And again, you'll see this oftentimes. Some of the not to-dos, I put it on my ear and hang it on my ear. So what's happened is then I potentially have contaminated all my whole shoulder and everything over here. When I touch it again, I've contaminated my hands again. You don't want to put it on something on your shoulder. You don't want to put it on your belt. You really want to fold it up so that the outside, which is potentially contaminated, is folded so you don't contaminate everything. Fold it up. Same thing with a cone mask that many people will see. What you don't want to see is after you take the mask off, so I take the mask off, I can't fold this mask up. So I really need to put it someplace in a bag, because if I leave it on the table like that, which is pretty much the only way you can do it, well, where's the contaminated part? It's right here. This is the part that's contaminated. So I want to make sure that I try to, wearing a mask is important. Wearing it inappropriately, wearing it incorrectly does not protect us to the degree that we could. So it's just an element about thinking about how to wear the mask in the context of, well, we're going to wear one, and most people aren't used to wearing one. They're not used to that always on the face element. So it's a challenge, and it's different for us just to think about how to appropriately wear the mask and what to do with it and what not to do with it. I also want to just reemphasize what Dr. Adler talked about. A number of physicians have come to me in the past few days talking about individuals who delayed care, who were concerned about coming to the hospital because of the concern that, well, I don't want to go to the hospital because I'll get COVID, I'll get sick there. Both institutions have worked very hard to, in essence, if you have respiratory symptoms, you'll be in this part of the emergency department or this area. And if you don't have respiratory symptoms, you'll be in another part, and they're separate. So we really encourage people that are diabetics. We have some diabetics who waited much longer than they should have with very high sugar levels and heart attacks and strokes and orthopedic fractured ankles and fractured hips that stayed home for a couple days because, well, maybe it'll get better, and didn't receive the appropriate care. So we really encourage people to, if you need to come to the emergency room, please do. The emergency rooms are still open, they're staffed. Both of us have set up plans for if there is a surge and a large number of people, here's how we'll gradually elevate the number, where we'll put people and where we'll gradually take care of more and more individuals. Lastly, I also just want to do, this is the other one that we see a lot of, is the glove thing. Because you see a lot of people wearing gloves today, right? We see people wearing gloves. Let's talk about that for a second as we do that. So when you wear gloves, well, you're wearing it to probably more so protect yourself. So now you feel like, well, I can touch anything. But if you touch something and then touch your face, or touch your mask, you potentially contaminate your face or your mask. So be very careful just because you have gloves on. The other component, when you take the gloves off, it's very critical and very important how you do that. Because the question is, well, what's contaminated? Well, it's the outside of the glove. So when you take them off, you want to grab them and take them off, so you turn them inside out and throw them away in the trash, and then wash your hands again. So we can't emphasize enough, yes, it's important to do all of these things. It's important to do it correctly. And the other principle is, as we've said many times, wash your hands, wash your hands, wash your hands. So we can't emphasize that enough.
Thank you, Dr. Wickert. That was great. Great advice.
Just one quick question. What about the balaclavas, the big, they're rather colorfully decorated, the same thing would apply, I'd assume?
Same thing would apply. It's that, remember, the outside that your potential is contaminated. So be careful about the outside. Try to turn it so the outside is inside. And so if you go waving it around or all those kinds of things,
Or
you're
if they just pull it down.
you pull
and
it
then-
down, it's
pull it
on your
back up.
neck, then you contaminate your neck, and, yeah, so trying to wear it appropriately, and you'll see, and by the way, we've had these discussions, and we teach this at the hospital. So you say, well, everybody should know at the hospital. No, they don't wear masks. And so now we're gonna do it as a larger community, so we just need to talk about how to wear it appropriately.
Thank you. Any additional comments from other panel members?
I'll just add that was excellent, thank you, Dan. I'll just add from the hospital's perspective, what is happening at the community level and physical distancing and social distancing is working. We have not experienced the feared surge yet, as Dr. Adler pointed out. It seems to be that it's always 2 weeks in the future, which is exactly what we want. Success, in my mind, will be we'll all feel like we over-prepared. We continue to have a few patients, but not the worrisome volumes that we are prepared for and that we've been concerned about. So thank you for the work that's being done in the community to stay to the expectations that are difficult but beneficial.
Thank you, Dr. Bean. Other comments?
I really don't have much to add since last week. City services continue as they were, using essential employees and rotating shifts, and that's all working just fine.
And we are doing much the same thing, although we are beginning to have those conversations about what a slow open or slow roll open looks like for us, and we're having those conversations at the department head level and with our partners in Lafayette and West Lafayette.
And same thing in West Lafayette. We're still somewhat challenged with our university population. There are still students on board. And that age group is the group that's going to live forever. As you know, from 18 to 26, they're invincible and nothing really adversely impacts them. So we have enlisted a lot of different groups to make contact, to gently educate, and try and encourage making sure they keep their distancing. And if they are in a collective, or at least collecting in one particular area, that they understand the potential repercussions of that.
Thank you. If there are no further comments from the panel, we'd be happy to entertain questions from the press.
Ron Wilkins from the Journal-Courier. Dr. Adler, you issued an order on April 8th closing down any social, you discussed it, closing down any social events, gatherings until at least June 30th. Mm-hmm. That order was not published until April 14th, and then only, it wasn't published by your department till April 14th, and then only after the city of Lafayette had published it. Can you explain the 1 week discrepancy between issuing the order and publishing it?
Sure. So the order was communicated to our, as I mentioned, the order was intended for organizations planning large community events. And so the order was communicated to those organizations, those planners on April 8th. A few days after that, we received an inquiry from another community organization with an excellent question about a different type of large community event, and the order was shared with them. The plan was to then discuss the order more at this weekly press briefing, but we decided that because other community organizations would need to start making alternative plans for their events in May and June, that we'd go ahead and put that information onto our website and release it as a press release.
Why wasn't it released last week at this event?
Honestly, I thought it'd be better to discuss it in this setting. It was not released at this meeting last week because we had not communicated that with the planning organizations for many of our large community events coming up in May or June.
Jeff Smith from WLFI. Does that order cover private events, large weddings, graduation parties, things of that nature?
No, this order covers large community events. Private events such as weddings, birthday parties, cookouts, things like that are not part of this order. They are covered, though, however, by Governor Holcomb's executive order, which prohibits gatherings of more than 10 people. As we know, Governor Holcomb's order currently is set to expire on April 20th. However, it is, I feel, very likely that that order will be extended for a longer period of time. So those private events would continue to fall under Governor Holcomb's executive order.
A couple more questions, Jeff from WLFI. The fact that we're now expecting the surge in late May, does that indicate that you're expecting the numbers to be flattened as well, that it wouldn't be as bad as perhaps it would have been had it been, Thursday of this week?
Actually, the surge is expected in early May, early May. That's a great question. The models that had been used previously that predicted the April 16th surge had been revised to show a lower impact for the state of Indiana than was initially thought was going to occur. And that lower number was attributed to the success of social distancing measures of the governor's stay-at-home order. As far as the revised surge for late April for Marion County, early May for the rest of the state, we don't really know if the same prediction of a lower number will still be in place, or if there'll be another revision that will increase that number. I think as we get closer to that date, we'll have a better idea, and the State Department of Health will be able to provide us with some better estimates of what we could be expecting.
We had a question come in from Facebook Live for both mayors. Are the cities wanting to put up hand washing stations for the homeless populations?
Go ahead.
That's not something that we've been asked before. I mean, I suppose it's possible to maybe rent some if that really becomes an issue. But again, I'd have to talk to the experts about that. It would seem like that would also, depending on how they're used, how they're touched, setting out in public could actually become a potential spot for the virus. I'm not sure that necessarily is a good idea. I'd have to defer to some of the experts if they think public hand washing stations would benefit us or not. It seems I could see some pluses, but I could also see some potential negatives with keeping those clean, keeping those, people are going to walk by and just touch them and not wash their hands. And so I don't know. I'd have to defer to the experts on that if that's something that would be worth a community investment or not.
And we've had something similar to that during public festivals. Obviously, we've had restroom facilities, portable restroom facilities and such. And like Tony indicated, a lot of times people use them judiciously. And other times not. And trying to stay within the lines of political correctness, oftentimes we offer up things to underserved populations that don't utilize them appropriately. And then the hope is if we provide any kind of an amenity, that the understanding is that this is for the betterment of them, of the individual and for the community, and that they would be used appropriately.
Dr. Adler, this is Dave Bengert with the Journal and Courier. You talked about suspected cases. What will you consider a metric for a suspected case, and how many suspected cases do you think are out there right now? We've continued to trail the state's rate of increase and cases by a wide margin. And can you speak to that as well, about why you think that is?
Sure. Suspected or probable COVID-19 cases would be individuals who have been evaluated by their healthcare provider and diagnosed with probable or suspected COVID-19, and for whom testing is not possible because perhaps they don't meet the criteria for testing, or testing may be deemed to not be necessary or feasible. So those would be individuals considered to have suspected or probable COVID-19. This is different from persons under investigation, which is a term that you often hear. Those are individuals who have been tested for COVID-19, but the test results are still pending. And so what we're hoping to do is get a better grasp on just how much coronavirus activity is really in our community by capturing or measuring the number of diagnoses of suspected or probable COVID-19. It's hard to say how much is out there. That's one of the reasons why we're doing this. We all suspect that there's more than we know about because testing has not been readily available or easily accessible. But to what extent that is, we don't really know. Could there be dozens more cases, hundreds more, thousands more? That's what we're trying to get a feel for. Our number of confirmed cases in the county, as you pointed out, has been lower than many other counties our size and even some counties that are smaller, which we're pleased about. As I said last week, we'll take any bit of good news we can get with this. Why that is, you know, I'd like to think at least part of it is the efforts we've all been making with staying at home, social distancing, taking all the precautions that we've been advised to take to help slow the spread of this virus. But I think time will tell, you know, how many cases we'll ultimately have here, how big will our surge be when it occurs in early May. And, you know, I'm hoping that by collecting that information about suspected cases, we can get a better feel for a better picture of what exactly is happening here in our community with COVID-19.
Jordan Smith from the Purdue Exponent asked, can factories or construction companies be forced to supply workers with masks upon request?
I don't really have an answer for that. I don't know if an employer can be forced to provide personal protective equipment for their employees. It certainly would be a nice and helpful thing to do for employees to do that, particularly for employers, particularly employers where their businesses involve a lot of contact with the public, where social distancing is not always possible. It would be very helpful for that to take place. As far as being required to do that, I think that sort of requirement would probably have to come from the state level or federal level. Did anybody else on the panel have any insight into that as far as businesses go?
Only that the businesses are very likely to face some of the same issues that those of us those in public safety and medical services are, that there are limited resources right now in terms of PPE.
There are quite a few stores that I've seen their employees do have some masks, but again, I think it's probably a supply issue for a lot of folks being able to even get the mask.
Jeff from WLFI again. Dr. Adler, as you start seeing the list of things that communities ought to do as they start looking at reopening, one of those things is contact tracing, robust contact tracing. Is the county still doing that? Are you soliciting volunteers to help with that effort? What's the status of contact tracing?
Yes, the County Health Department is still doing contact tracing. We have a team of public health nurses that do our contact tracing and contact investigations. We are, as I mentioned last week, hoping to incorporate some volunteers into that process, specifically other healthcare professionals and students at the IU School of Medicine or in other health professions through Purdue University. So that having an additional pool of people to help with that will be important, especially as our case numbers rise in the next few weeks.
Ron Wilkins from the Journal and Courier. Commissioner Brown mentioned that they are beginning conversations about reopening a slow roll, I believe is what you said, Tracy. So the question for everybody on the panel is, what does reopening look like? And roughly, I'm not asking for a specific date, but roughly, when will people start to see shops start to open, and what will the reopening look like, and when can we expect that?
Well, I would begin by sharing, what my vision is. First, it would take action by the governor to lift the stay-at-home order and give further guidance through an executive order. And then it could very well look much like the way that we closed, only in reverse, meaning that we would slowly start bringing staff back into government operations and likely not open doors to the public right of way, and then slowly do that as we're able to do that. We keep in mind that many of our offices are able to work remotely, so government work still goes on differently than it did before. A lot of meetings have been canceled throughout this process. We are becoming much more adept at doing virtual meetings. We're not perfect yet, but we do anticipate that this is something that we will continue to do as long as we're under the emergency. So sort of a reverse process, but measured as we move forward.
Yeah, and I would like to add also, I agree with Commissioner Brown that probably the first step in that process will be the governor's actions in terms of his executive order and what sorts of reversals that he would start to implement in those executive orders. I think that one thing we can certainly say about the process of reopening our community, just like any other community, is that the process will be slow. I heard yesterday a great quote from the director of the World Health Organization that said, he said that the way down from your peak is much slower than the way up. So the process of reopening our communities and getting back to our normal lives is going to be a longer process. It's going to be done very carefully. It has to be done in a gradual and graded process. The Federal Emergency Management Association and the CDC did release a document on April 10th about the reopening of America and how that would look. And it does lay out several different scenarios depending on the amount of virus activity in a particular area, but all of those scenarios involve a longer process. And the reason for that is because we don't want to see a rebound, a second wave or third wave of cases. And the CDC and FEMA plan does talk about even the possibility of a large rebound in infections even after 6 months of time has passed. So it's going to be a longer process, and we'll have to just take things, one day at a time and see how this all unfolds.
And to that point, I can't speak for Tony and Tracy, but I'm getting a lot of emails from people asking that we, as governmental leaders, knock off the shutting down of the communities. And again, ignoring the fact that it's a directive from the governor, ignoring the fact of how easily communicable this disease is and how contagious it is. And honestly, nobody on this panel wants to keep things shut down. We would all love to go back to normal. But there's some very big decisions in West Lafayette that need to be made early. We have 40-some-odd thousand people who come and go from our community every semester. And that is a major undertaking. So we need to be very focused and very realistic on how much longer things need to be contained. What does that containment mean? How does it apply to the academics that we have going on in West Lafayette? How does that apply to some of the other things we're doing just for pure socialization? And it isn't just the matter of either turning on or turning off a valve like some people think. And as Dr. Adler was saying, the process itself changes almost daily because of what we learn and what we know more now than what we did before. And it is. This is a challenge that's going on in every community around the world now. And I think that, we are, and if there was wood here, I'd touch it, but we're very lucky to have such a compliant community. I mean, Greater Lafayette and Tippecanoe County, we're doing a great job. I think that can't be stated enough when we talk about our numbers, is the fact that people are engaged, they're listening, they're taking their direction well, and they're doing exactly what they're supposed to do. And we're going to continue to encourage that until we get the guidance where it's no longer necessary.
I'll just, at the risk of being redundant, and I agree with the panel, and I think this community has a unified approach to this, that the first step would have to be the governor and the stay-at-home order, and myself, along with many mayors in Indiana. A letter went out right at the beginning of this from AIM asking that mayors sign on to the premise that we would follow the governor's directive and those directives to help keep some uniformity in the state. And many, many mayors agreed to that, and I think that's the proper step to continue, that's where we would have to start, and then work slowly back into the process as that information came out based on science and data and good sound medical practice. And as John said, I know it's a unique challenge with Purdue, because I don't think it's lost on any of us that if Purdue was still in session, the students were still here, our numbers would look much, much different than they look now, and we would be in a much different place, I believe, than the good spot that we're in right now. If those 40,000 students or so were still here in the community. And so we do have some unique things to think about as a community of how we unfold this, and with the students who go back and forth throughout the whole county, how that looks and how we do it correctly.
Question from Facebook Live, Thea Strand. Throwing away gloves is no longer an option because we can't buy them. Can we wash our hands with gloves on and then carefully remove them?
Not the ideal, but if you can't find gloves, that's the best alternative. It's just wash your hands, take your gloves off, set them out to dry, and then wash your hands again. So wash the gloves, wash your hands. If you can't find gloves, that's the best alternative.
Dr. Adler, with the large community events shut down through June, do you think that we'll be talking about this with, say, Purdue football, high school sports, those kinds of things? I mean, are you already at that point saying that's going to be a likely case that those will be postponed to?
We're not really sure at this point. We'll be looking at those issues, so events for July, August, September, as time goes on. And I think a lot of it's just going to depend on how this pandemic unfolds here, when we reach our surge, and what happens after that. So I don't have an answer for those events that are later on at this point.
Dave Bankert with the Journal and Courier. Again, would you make the same recommendation? I know Purdue has a specific task force looking at what campus is going to look like, and Purdue seems to have been a couple of steps ahead of everybody trying to figure out for such a large institution. Is your recommendation going to be that they should bring people back to residence halls and even to large apartment complexes when it comes time?
You know, we haven't gotten to a point where we've been able to make a recommendation about that, because it's still obviously several months away. But you know, I think that you know, if and when that happens, it's going to look very different, I'm sure, from what the university looked like earlier this year. We'd be in the middle of the sort of reopening process, that slow process, and of course, social distancing and other preventive measures would still need to be in place, and that would likely change the face of the university, just like it would change the face of any large organization. But how that will look at that time, I think it's too early to know.
And to that point, Dave, with Purdue, the presumption is with athletics, Babinski's already, the athletic director's already made some statements in regards to what that may or may not be. And the challenge is, and you're going to hear a lot of repetitiveness here, is that we don't know when things will change in the positive. It's difficult to predict. And schools and other major organizations like colleges, university, high schools, they have to have a plan of action in place significantly before it's actually going to be executed. So things are moving very slowly in academics, in attendance, and things with Purdue, and they're also moving very slowly when it comes to development. The same thing applies. If somebody had a crystal ball and could say, this is when it starts, this is when it stops, then it would be like firing a starting pistol at the beginning of the half marathon. But we don't have that. We don't have that luxury. So everything's going to move slowly, and it's going to move methodically, with the eventual direction being getting back to whatever normal will be then.
Jordan Smith from the Purdue Exponent. Mayor Dennis, is West Lafayette going to create a joint task force with Purdue administrators to reopen Purdue University?
We already have that in a way. I mean, we're communicating with Purdue's administration, but right now we're more focused on containment and prevention because there's so much unpredictability with timelines. We're just going to try and do what's right for the immediate future. We can't go that far down the road.
Alex from Facebook Live. Can the mayor and health department please ask our citizens who use public transportation to do so for essential travel only?
Yeah, that's an excellent point, and I believe the governor's executive order actually does specifically mention the use of public transportation for essential purposes only. So essential travel would be things like going to the grocery store, going to the pharmacy, going to your doctor's office, traveling to take care of family members or other individuals that need your assistance. Traveling to and from work, of course, is an essential travel. So those are the sorts of essential travel that we all should be adhering to, and of course people who ride public transportation should also be adhering to those essential travel guidelines.
And I would agree. I mean, I've heard from some folks that we do have people just using the bus system to just kind of ride around and just sightsee because they're bored, and we certainly do not want that taking place, because we need to keep the other folks on the bus that are using it for the right reasons safe, and the bus drivers safe so they can continue to operate the buses. And yeah, we don't want people just riding around on the buses just sightseeing.
Dave Bangor again with the Journal and Courier. Are there any trends in the numbers of the confirmed cases so far, whether in where they live, in housing, any jail cases? I know other counties have started releasing have been digging deeper into the demographics. Is there anything you can tell about what we've seen?
As far as I know, there are no jail cases here in our county. As far as the other cases go, there are several of them that are linked because they are family members or people who have had close contact with another confirmed case. But there's not a specific group or institution that's had a lot of cases here. You know, in other counties, you hear about a particular nursing home has several cases or a dozen cases, and that's not been the case here in Tippecanoe County. So again, the ones that are linked are ones where there are family members or individuals who had close contact with another infected person.
Just to follow up on that, last week we talked about how many were still hospitalized, how many had recovered. Of the people that we have, what's the second stage for them?
Okay, so you know, in terms of recovery, as we mentioned last week, the recovery from COVID-19 is unfortunately a long recovery process and appears to take 2 weeks or even longer. So the folks who were diagnosed as our earlier confirmed cases, you know, they're getting closer to that point of recovery, and we expect, of course, that they will recover. But it's been a longer recovery process than I think anybody anticipated, and that's true in every community and around the world, that this is a disease that just takes longer to get over than people anticipated.
How about hospitalizations? Do we know those numbers? How many people are hospitalized?
Dr. Bean and Dr. Wicker, do you want to comment on
It's
that?
still hospitalized at single digits today, and we've had that number fairly stable with an equal number or a little bit more of people hospitalized who are under investigation. So their test was still pending.
So we had, this morning, we had 6 positive cases in the hospital and 15 that we're waiting on testing. And those numbers have been fairly consistent over the past a number of weeks as we communicate back and forth between the hospitals. Those numbers may bounce a little bit, and one time some will have more than the other, but they're under 10 for both hospitals, and we just have been fairly consistent over the past few weeks.
And it's important to remember that our hospitals do care for a large number of individuals from outside of our counties too, being 2 of the larger hospitals in our region.
Question from Facebook Live from Cindy. Is the intent of the local order for preschools to cancel summer programs?
Preschools, just like other schools, would fall under Governor Holcomb's orders, and I'm anticipating that Governor Holcomb's executive orders will probably be extended. I don't know for how long, but I would look to those orders for guidance on preschools.
And this question is for Tracy. What preparations are being made for the primary and general elections to ensure that everyone can vote and do so safely?
Well, I'm actually very fortunate that our county clerk is in the audience right now and has been talking to the Board of Elections, as a member of the Board of Elections, so I'll turn that over to Julie.
Okay, so on Friday, the Indiana Election Commission is going to meet, and they're probably going to adopt several policies for the election. And what those, some of them probably will be, is that we're going to have a shortened early voting from May 26th to June 1st. Election Day is still going to be held on June 2nd, which is a pushback from the original day of May 5th. The state is also helping procure personal protective equipment for election workers, and we're working on that too. I do want to ask anybody if they would drop off any sanitizer with the pumps at the front office, that we want empty bottles, so that Purdue is working with us to fill those, but we don't have the pumps. That's about it.
Thank you.
Thank you.
Another question from Facebook Live from Thea. What is the reality of the PPE here?
Well, as other panel members have mentioned, PPE supply, of course, is an issue for everybody across the country, especially healthcare providers and for other people who need the PPE to carry out their work safely. We've been fortunate here in Tippecanoe County to receive a couple of distributions of PPE from the Strategic National Stockpile. That's the federal government's stockpile of PPE. And we were able to distribute that PPE to long-term care facilities and emergency medical providers. So that, of course, has helped with PPE supply for those individuals. And I think, moving forward, we're not sure how bad our surge is going to be here. We're not sure how long we're going to be dealing with this. And so, of course, one of the issues is will we have enough PPE, when the surge comes, or alternatively, will we have enough PPE to last the length of this pandemic? Of course, more PPE will be manufactured and, of course, made available as time goes on.
Okay, and this will be our last question from Facebook Live. Robbie Bradford asks, what are the implications for religious gatherings through the end of June?
So the order for large community events does not apply to religious gatherings. Religious gatherings are covered under Governor Holcomb's executive order. So I would refer people to that executive order for guidance on religious services. And those services, of course, will need to follow Governor Holcomb's orders for gatherings of only less than 10 people. Are there any additional questions? Okay. Well, thank you very much for attending. We'll see you next week.